After more than a year of coronavirus restrictions, England opens up. But with one of the highest infection rates in the world and hundreds of thousands forced to isolate, is this the right time to throw COVID caution to the wind? I'm Andrea Sankey, and today's newsmaker is England's so-called Freedom Day. Well, the UK government has always said it will take an approach based on data, not dates, when it comes to lifting pandemic restrictions. So how does the data look? Well, on Sunday, more than 48,000 Britons were newly infected with COVID-19. That's the highest daily tally in the world. Even the double-jabbed health secretary tested positive, forcing himself, the Prime Minister, and the Chancellor to self-isolate. And they're not the only ones who will be stuck at home on what's being called Freedom Day. More than 500,000 people in Britain were told to self-isolate after being pinged by the government's Test and Trace app. It's not all doom and gloom, though. 2/3 of adults have received 2 vaccine doses, and while infection rates are high, fatalities remain relatively low. But Professor Neil Ferguson, whose research led to the country's first lockdown, has warned the situation could get a lot worse very quickly.
I think it's almost certain we'll get to 1,000 hospitalizations today, per day. It'll almost certainly get to 100,000 cases a day. The real question is, do we get to double that or even higher? And that's where the crystal ball starts to fail. I mean, we could get to 2,000 hospitalizations a day, 200,000 cases a day, but it's much less certain.
Well, joining me now from London is Anthony Grayling. He's a philosopher and the founder of the New College for Humanities in London. Paul Hunter joins us from Cheshire. He's a professor of medicine at the University of East Anglia. And in Sheffield, England, is Dr. Andrew Lee. He is a reader of public health at Sheffield University. Thanks all so much for being with us. So, data, not dates. But the government does seem pretty fixated on sticking to July 19th. Anthony Grayling, let me ask you first. Is there an element of maybe avoiding embarrassment here in spite of the risks, or is it now simply the right time to reopen?
No, it's nowhere near the right time to reopen. I mean, we're going to hear from the people who have expertise. Professor Hunter, Dr. Lee will be able to say something about the dangers that the epidemic still present to our society and to the world. But this is economic and political motivation. It has nothing whatever to do with the medical advice or what is rational. And I suppose if there's anything that I could contribute to this debate, it is that proportionality, just thinking about the risk to the population, people of all ages, just thinking about where we are at the moment in the pandemic and the number of people who have so far had full vaccination. And it is far, far too early. No matter what the cost to the economy, human life is just far too precious, really. And when we think about the possible dangers to children of COVID, and long COVID in particular, it just seems to be worse than irrational to be ending the restrictions now.
Okay. Paul Hunter, should we really be concerned, or is now as good of a time as ever to actually do this because of the double vaccination rate of a majority of adults? And considering as well the risks to public health if we don't reopen, not least mental health?
I think it is never going to be the right time to open. Whenever we open society, we're undoubtedly going to increase transmission. The problem that I have, though, is that looking at thinking through the possible scenarios for the coming year, opening now has the advantage that we're moving into the summer. The schools will be closed. Many more people have had the vaccine more recently than in the UK. If we leave it till September, we are already seeing vaccine effectiveness declining. This was predicted in a Nature Medicine paper some months ago. And Israel is already commenting on at the moment that even with the Pfizer vaccine, they're seeing declining immunization effectiveness. Also, if we leave it till September, what will happen is that children will be back at school, so that any subsequent surge in September is likely to be more dramatic than we will likely see during the summer. In the autumn, we will be having a booster vaccine campaign, probably just for the people over 50 and people with medical conditions. And that will probably take us to December or November, December. If we relax then, the problem is that we might well see large numbers of other respiratory viruses circulating, including influenza. And there is evidence that these are starting to come back. And the problem is if you get influenza, particularly at the same time as you get COVID, you're double your risk of dying. So, there isn't a good time to open society, but I think looking at the possible options, opening before the summer, when schools are opening, when schools are closed, probably carries the least risk of harm to public health.
So let me just clarify. I mean, we shouldn't be surprised if this reopening just turns out to be a break in COVID lockdown restriction.
Absolutely. I mean, whenever we release restrictions, we will see increased cases. But as the Director General of the World Health Organization has said more than once, COVID is here for good. So people who haven't had vaccine or a declining vaccine at some time will get COVID over the next few years. People who have had vaccine, many of us who have had vaccine, will still get COVID infection at some time over the coming years. The other coronaviruses that spread within society typically infect us about every 3 to 6 years as adults, more frequently as children. And I think there is every indication that COVID will follow that pattern.
Andrew Lee, let me ask you, is this just has to be, we've heard before that COVID is something we're going to have to learn to live with. So is this almost a necessary pause in a sense that the public will need in the larger scale where we might have to see lockdowns again in the future? Or is this just irresponsible at this point, given that a record was broken on Sunday in case numbers?
Indeed. And I must say I agree totally with Paul on his points, really. Just a couple of points to raise. When we look at the roadmap to lifting of lockdown, this was produced way back earlier in the year, before there was the Delta variant, at the time that the Delta variant didn't really figure. And when you look at the situation now, we've got skyrocketing numbers, as you've mentioned, 50,000 plus cases at the end of last week. We're in the midst of the third Delta wave, driven by the Delta variant at this point in time. So it seems a rather strange decision to be making now. I can also understand the justification for trying to push it now rather than into the autumn when schools reopen. But what we're seeing now, paradoxically, are some of our winter viruses happening now, such as norovirus and respiratory syncytial virus starting to emerge out of sync to when they normally would. So this idea about trying to avoid the winter rush of healthcare demand might not just hold.
Okay. So Andrew, let me ask, Anthony, sorry, let me ask you, if hearing what you heard from the other two panelists made you feel any bit better about at least lifting restrictions during these summer months, or do you still think this is a terrible idea, especially given that we're not even going to see basic mask wearing and the social distancing that really costs the economy nothing?
Well, look, I agree with Professor Hunter that no time is a good time, but it does seem to me that there are better times than others. And the right time might be when we have a much, much more extensive number of people vaccinated. And if we were able to get to about 80% of the population fully vaccinated, that would be a huge help. It would be a tremendous help also if, as the tweaks to the vaccines come on stream in the autumn against, for example, the beta variant and others, and booster vaccines are available, that would provide extra help also. When you lift the restrictions, of course, you're not only making it possible for COVID to circulate, but all those other viruses will be circulating as well. I mean, all you have to do is just think about what it's like in a very, very crowded nightclub with, hundreds of people packed together, all sweating and shouting and dancing and carrying on. They're going to be spreading absolutely everything they've got to spread. And if that means if multiple viral infections are representative of a much increased danger, then I think we're really asking for trouble.
Okay.
It seems to me that the thing to do is to be ultra cautious, always to be more cautious even than seems necessary in order to protect life and to learn as we go along how best to manage this, given that we are going to have to live with it permanently.
Right. You know, Paul, let me ask you that question, though, that I led into to Anthony with, because fine, we understand the economic damage. We understand also that there can be damage to mental health if we continue with these kinds of restrictions. But it's such a simple measure and it's such a huge differential when you measure how much safer we are just by wearing masks to block those moisture particles. Why not at least keep those basic restrictions, just minimal social distancing that doesn't hurt the economy, and the mask wearing so that people can at least feel that these dangerous particles, the Delta variant in particular, is not spreading exponentially just on the streets and out in the open?
Yeah, I mean, indoors, certainly masks contribute to reducing of transmission. And I think many of us, myself included, if we're in a crowded indoor environment, would continue to wear some form of face covering. And I think that makes a lot of sense, particularly if we are in an older, more vulnerable age group like myself. And the issue, though, really is pretty much everybody is going to, for the rest of our lives, get COVID, or at least the SARS-CoV-2 infection repeatedly throughout the rest of our lives, because that's what's happened with previous coronavirus pandemics. And that we still see now, and that effectively are just one of the causes of the common cold. So to me, the whole point of the vaccination program was getting as close as we can to the point where when people experience their first infection, they either fight it off without getting infected, or even if that doesn't happen, they're protected against severe disease. So, and I think we're probably as close to the maximum as that we can get at the moment, because although we are still rolling out the vaccine campaign, it has slowed down considerably in the last 2 weeks. And if that continues, we will certainly get to the point that the new vaccinees that we're managing to vaccinate may not be enough to compensate for the waning immunity that we'd be expecting with the in people who have been double vaccinated. And we're seeing this already. You know, for example, our own Secretary of State for Health has got the COVID infection despite being fully vaccinated.
Right. So, Andrew Lee, I mean, the waning immunity is one issue, and then there are, of course, these variants that are highly unpredictable. I mean, some are even saying the UK could actually become a breeding ground for COVID mutations that could endanger the world. Is that an exaggeration, or is this unfair for the UK to be doing to the planet itself?
Well, I think that's a slight exaggeration. I think we cannot predict with certainty where the next variant is going to emerge from. We know that a variant is more likely to emerge when you have lots of infections going on. That's true. But if you were to look at the Alpha variant, for example, that came out of Southeast England earlier last year, that rose out of someone with chronic illness, so a prolonged infection. So a very different set of circumstances. So the conditions need to be right. I agree with Paul as well. Eventually, this will become part and parcel of the viruses that we will encounter in our lives. My only concern, though, is this virus is still fairly new. It's still evolving. We haven't reached stability yet. And just as it can mutate to become more infectious, as it has done so with the Delta, so too could it mutate in the other direction in terms of severity. So we're in uncharted waters at the moment. And
Right.
I'm inclined to agree with Professor Grayling that caution makes sense.
Yeah, and Anthony Grayling, you had also said earlier that you're specifically concerned about the youth because there are now increasing cases and risks among young people, as well as the symptoms of long COVID, which can prove even arguably more detrimental to the economy because these are youth, our working population that can't properly work. for months to years at a time. Do you think that really is being underestimated?
Well, I don't know the correct answer to that from an epidemiological medical point of view, but the mere possibility that there might be very, very long and serious consequences of COVID infection in young people just by itself should be a reason for being ultra careful. And it's terribly difficult for young people. I mean, my own undergraduates, for example, my first year undergraduates of this last year, who had been looking forward to university for several years and have been, working terribly hard to get their entrance examination results suitably, and then to be, stuck in their bedrooms at home with their parents for their first year of university, having looked forward to all those parties and love affairs and so on. I mean, one can really understand the frustrations and difficulties for young people. But again, that point about being cautious, it really does seem to me to be the sensible way forward. And one point we mustn't overlook in this discussion we're having is that the UK is something of an outlier in the surge that we're seeing at the moment, because cases here are spiking up very dramatically. We're far ahead of all our European neighbours, for example, in the degree of increase in the rate of spread of the infection, the number of reported daily infections. We have a much more serious problem here. And that point about breeding variants here, just because of the very high numbers that we have here and the fact that we are simultaneously lifting restrictions, is a point which shouldn't be dismissed. I mean, I do think that it is an irresponsibility of our government, not just to its own people, to be lifting mandatory requirements on mask wearing and public transport and so on, but also to our neighbours and friends around the world.
Right. There is a responsibility, Paul, to the people that the government should be very much aware of. There's also a responsibility to the NHS. They were overstretched before the pandemic. People needing treatment for other illnesses have had to delay those treatments as well. And now the NHS has expressed concerns that you're going to ask us to potentially risk seeing thousands more patients than we had ever budgeted for. Where's our consideration?
Absolutely. And going back to what we said at the beginning, whenever we lift restrictions, it will undoubtedly lead to more pressure on the NHS for some time after that. The issue is, when is the best time to lift those restrictions that ultimately leads to the least pressure on the NHS as and when they are lifted. Can I just go back as well to the issue about new variants? We do know that when any new virus jumps host, it generates large numbers of variants as it evolves to try and best fit its new host. And we've seen that dramatically with COVID. Initially, the very early mutation variant, the DG416, I think, then the Alpha variant, and now the Delta variant, and that is to be expected. But what we know from other viruses is that the rate of these new variants appearing drops substantially over a relatively short period of time. Okay. And that is when the virus, the dominant virus, has achieved the best fit with its new host. So although we've seen these new variants appearing in the past, all of the variants of concerns at the moment arose well before Christmas. And at the moment, there's nothing obvious. That doesn't mean to say they won't arise, but looking at the way that the many of the variants around that have co-evolved roughly the same clusters of mutations, we must be getting close to the best fit. And once it does that, future variants arrive much more slowly. And those future variants generally are what's called escape mutations, where you get some reduction in the ability of prior immunity, whether that's natural infection or vaccine, to escape that. Okay. But they are very rarely a major shift that totally undermines prior immunity and vaccine.
Paul Hunter, I will have to give you the last word. Andrew Lee, I apologize for not being able to come back to you, but unfortunately the clock is against us and we are completely out of time for this edition of segment, actually, of the Newsmakers. Thank you all three so much for being with us. We appreciate it.
My pleasure.
Well, we just heard that we'll all have to learn to live with COVID-19, but does that mean the world's biggest sporting events should carry on regardless? The Olympic Games begins this Friday, despite the host city, Tokyo, being in a state of emergency due to rising coronavirus infections. Tens of thousands of athletes and support staff from all over the world have made their way to Japan. Now, despite promises of a safe and secure event, many Japanese are worried. Almost 500,000 people signed a petition to cancel the Olympics, but with the Japanese economy taking a brutal hit during the pandemic and more than $15 billion invested in these games, the government is desperate to get back on track. And with sponsors pulling out and any return on investment looking less likely, is holding the games worth the risk? Well, to discuss that, let's get to our guest, Seijiro Takeshita, Professor of International Business Management and Information at University of Shizuoka. Thanks so much for being with us. We appreciate it. There's usually, so much anticipation and enjoyment associated with just the run-up to the Olympics, not to mention the games themselves. But these are, to use an overused term, unprecedented times. How does it feel to be in Tokyo right now with the Olympics coming?
Well, it's bewilderment to say the least. I mean, the Japanese were really having an open arm to this Olympics, particularly because of the great success that we had in 2019 Rugby World Cup. And also we were ready to show our, what we call omotenashi, which is our willingness to welcome people from overseas. And also it was an ignition point for Japan. We were going through decades of what we call the lost decade. Meaning that we really couldn't find some kind of I would say, an ignition away from the stagnated conditions of Japan. We were hoping, as it did in 1964 Tokyo Olympics, this Olympics would really give us some kind of an icon and some kind of a revolution of a new start. So people are really looking forward to this. But of course, with COVID-19, with a new variant, appearing very, very quickly, and right now, seeing the wave of this COVID-19 bigger than the fourth wave that we've had, certainly people are backing off very quickly.
Right. I mean, we know 500,000 people signed a petition to cancel these games, but what should really happen? Should it have been delayed perhaps another year? Were there other options, or is it just a loss?
Well, we know that even though there could be a lot of, I would say, economic negative consequences to be seen, 70% of income is secured by the broadcasting rights by the American broadcasting houses. So if that is secure, then it's not going to be that much of a big loss from an economic point of view. But this indirect, I would say, effect, and also the legacy effect is very, very negative. What should have been done, although we're talking about, spilled, milk, but the fact of the matter is that we should have really put the accelerator on increasing the level of vaccine, because in Japan, only 20% of the population have completed their vaccine, compared to like 50% in the United Kingdom and the United States. So certainly, considering the very, very conservative nature of the Japanese people and organizations, I can easily understand that they're really worried about this current event.
Yeah, it is a bit of a shock. I mean, Japan always seems to be ahead of the curve in so many realms, but to fall so far behind on the vaccinations, especially with this event coming, it is strange, to say the least. But let me ask you this. The IOC rules are that if Tokyo cancels the games, it breaks the contract, and that makes Japan actually fully liable for losses. I mean, is that fair in the context of this pandemic? How much does the IOC actually kind of bear responsibility for these games taking place now amid this fear?
I think to answer your question, it would be a question asking, I mean, does lives of the Japanese really matter or not? I mean, are you really putting priority over the event, over the lives of the Japanese? And, I don't think IOC would have a clear answer to that. They'd probably come up with some kind of an excuse. But, that's how, most of the Japanese are feeling quite negative about this event. In fact, 80% of the Japanese are hoping that this would have been canceled altogether, or at least been delayed, as you noted. Right. Particularly because of this spread that is still taking place at a very, very accelerated pace, especially in the Tokyo area.
Let's just be honest, though, about the budgetary concerns. I mean, the budget for Tokyo was supposed to be about $12.6 billion originally. Some think it's actually really costing double that. Is it a concern to the Japanese right now, or can they simply just ignore whatever monetary value is placed at this loss because they really do believe the lives are more important? Or do they have to accept the fact that this is a huge hit to the economy?
Well, actually, it's both, isn't it? The fact of the matter is, it's a balance. We have to be putting on the brakes and accelerate at the same time. That's the negative, I would say, dilemma that we're facing right now. Of course, we want to have the positive economic effect. It's not only the direct implications, but indirect implications. For example, increasing the number of, inbound tourists in the future by, understanding the Japanese legacy, for example, through this Olympics. Many people are hoping that there could have been a lot of indirect positive issues that could be borne out from this. But unfortunately, that's not going to happen because of the current situation. We are not going to see any foreigners coming in, and the Japanese themselves are very reluctant to basically join in on this, as you just reported earlier. So, from the psychological point as well, it's becoming a very, very negative event as a whole.
Sujiro Takeshita, unfortunately, we're going to have to leave it there. Thanks so much for taking the time to speak to us on the Newsmakers. We appreciate it. Our viewers, of course, for being with us as well. I'm Andrea Sankey. We'll see you next time.